Hello, I'm Dr. Carrie Jones, Medical Director for Precision Analytical, creators of the Dutch test. It's September, and that means it's PCOS Awareness Month. PCOS stands for polycystic ovary syndrome, and it's the most common endocrine disorder that females experience. In fact, some research says as high as 20 to 30% of women experience PCOS. To diagnose PCOS, we commonly follow something called the Rotterdam criteria. In the Rotterdam criteria, you have to have 2 out of 3 to be considered PCOS. Number 1, cysts on ovaries, diagnosed by ultrasound, but you don't have to have that despite the name. Number 2, hyperandrogenism and clinical symptoms. This means on testing, you're going to have high levels of testosterone or DHT, DHEA, and the symptoms such as hirsutism, which is hair growth in places we don't want, and of course things like female pattern baldness. And 3, cycle irregularity, anovulation, trouble with fertility. To be diagnosed PCOS, you have to have 2 out of 3, which means you can have the hyperandrogenism and the hair growth in places you don't want. You can have cycle issues, ovulation issues, but you don't have to have cysts on ovaries. Just like you can have the cysts on ovaries and the hyperandrogenism, but your cycles are fine. To help you further diagnose and explore PCOS, this is where the Dutch test comes into play. The great thing about the Dutch test is that we do look to see how are your progesterone levels. This gives us an indication as if you have ovulated. We evaluate your estrogen and your estrogen metabolism. Commonly, and those with PCOS can experience either estrogen excess or estrogen deficiency, especially in those women who have long irregular cycles or amenorrhea where they don't cycle for many months. The Dutch test also looks deeply at androgens, your testosterone, your DHES, and your 5-alpha reductase pathway that leads to DHT. 5-alpha DHT, which is dihydrotestosterone, is a very potent androgen and can result in those things such as hair growth in places you don't want, but loss of hair on the head. The other great thing about the Dutch test is that we evaluate cortisol. Cortisol has a huge impact on the way that you're going to make hormones. Cortisol can do a feedback back to the brain to tell the brain to not ovulate or not produce hormones the way that you would like. So by understanding your cortisol, you can get insight into the way that your female hormones are functioning as well. In addition, the Dutch test also looks at organic acids such as B12 markers, B6 markers, glutathione, an oxidative stress marker, and of course, the hormone produced at night known as melatonin. There's a lot of literature out there on the hormone melatonin as it relates to PCOS and its protectiveness. By doing the Dutch test, doing the Dutch Complete, the Dutch Plus, or even the Dutch cycle mapping when you're trying to evaluate the cycle all month long as it relates to somebody that you suspect has PCOS, or you're working with them on their PCOS, can give you a whole lot of insight because of the comprehensiveness of the results that you're going to receive. So I hope this helps explain what PCOS is, why it's so important, being the most common endocrine disorder that females experience, and how the Dutch test can help you. Again, my name is Dr. Carrie Jones, and thank you for listening.